So today's class is called the Disc Healthy Spine. This class is appropriate for individuals that are suffering from a bulging disc, a herniated disc, symptoms of sciatica, maybe all the above. So I'm going to be teaching the class on my yoga mat. So if you are really struggling getting up and down off the floor, feel free to do these exercises in bed, okay? If you're able to get up and down, go ahead and move to the floor. Just make sure you have a little bit of cushion underneath you. Good morning, everyone. Just giving it a few moments to let some people join the class. If you're just joining me now, this is the Disc Healthy Spine class, part of the Healthy Back series. So this class is appropriate for individuals that are struggling with a bulging disc, herniated disc, or symptoms of sciatica, or all of the above. Okay, and we're going to go ahead and get started. Thank you so much for joining me this morning. My name is Dr. Lori Brandt. And before we start with the exercises, before we start with the class, I wanted to talk about what it actually means to have a bulging disc or a herniated disc in your low back. So this topic is near and dear to me. I am a physical therapist, and what I treat all day long is individuals that have been in car accidents, and pretty much I'm treating herniated disc, bulging disc, back problems, spine problems, whiplash, okay? In addition to that, I unfortunately have a herniated disc in my low back, and I've been struggling with that for the last few years. However, I can say that my back issues don't hold me back from doing anything. So I'm able to do anything and everything that I need and want to do. It's just that sometimes I have to do these exercises I'm about to show you when I start having symptoms, okay? So when we have a bulging disc in the spine, so the disc is the cushion in between the vertebrae, all right? So what a bulge means is basically that, exactly as it sounds, that disc has basically pushed out, and it's pushed out backwards, so towards like this direction, okay? And usually when you have a bulging disc, for the most part, not always, but for the most part, it will bulge to one side or the other. So it can also go central, but usually it's one side or to the other. That's why a lot of individuals will have more pain on, say, their right side or the left side. Now it can go what's called central and bulge out straight back, and unfortunately those individuals are going to have pain basically on both sides. But usually with a bulge, the majority of the symptoms is back pain and a lot of pressure sensation, okay? Now, basically, the difference between a bulge and a herniation is kind of a bulge is the precursor to the herniation. Herniation is when the inside of the disc, if you want to think of it almost like a jelly donut, actually gets squished out. And part of that, when you have a disc herniation, same thing, it usually goes to one side or the other. And this is when you're going to get symptoms of sciatica. So sciatica is not a diagnosis. It just describes symptoms going down the leg. So a lot of times you'll have symptoms going down one leg or the other. Sometimes it can be both, but usually it's one side or the other. And those symptoms can go all the way down into the foot and ankle. Okay, so these are the exercises that I'm going to show you to help with those symptoms, whether it's the pressure sensation you're getting in your low back or that symptoms going all the way down into the leg. Now, there's other reasons why some people can have sciatica symptoms. Unfortunately, as we get older and have degenerative changes and arthritis in the spine, that also can cause those symptoms. It's usually called something called spinal stenosis. All right, so we're gonna go ahead and get started. So my rule with these exercises, my rule with this class is it should not be increasing your symptoms. It's okay if you have a lot of sensation. It's okay if you're feeling a stretch, but if you're having a lot of pain, that's when you want to back off. Now, some of these stretches, you might get an increase in sensation. You might start to feel like some tingling or some sensation going down the leg. That is perfectly normal because we are going to be mobilizing the nerves as we go through these stretches. Okay, everyone, let's go ahead and get started. So we're going to start in a seated position with the legs straight out in front. Now, if this is too uncomfortable, if your disc problem is too acute, you're gonna sit in a chair for me with a straight back, and you're just gonna straighten one leg out. Just pick whatever side you're having symptoms, and that's the one you're gonna do. So if you're sitting, just straighten one leg out, okay? All right, so from here, I want everyone to round into their back a little bit, almost coming into a slouch posture. Now, what that is doing, it's putting our spinal cord on a stretch. Now, this position you only want to do when you're doing these stretches. Now, let's just take it a step back. When we go into a flex spine position, it actually will push the bulging disc or the herniation back a little bit more, which is why you will have symptoms more so with bending activities and less with, say, standing or walking around, okay? So this is not a position you want to stay in, but for therapeutic exercise, I want you to go ahead and round the spine, all right? So my legs are straight. If it's too uncomfortable to keep your legs straight, you can put a blanket or a towel underneath the knees, but I want you to flex the feet so they're pointing straight up towards the ceiling. If you're able to splay out the toes, so now we're getting a nerve stretch all the way down from our low back into the toes, okay? All right, so round, let the shoulders round as well, and just drop the head down. And take a breath in and then look up towards the ceiling. Don't force it, just go nice and easy and exhale, round down. If you're wondering what we're doing, we are mobilizing the sheath that surrounds the spinal cord. And inhale, look up towards the ceiling. Exhale, round down. Inhale, look up. We're gonna do this 10 times. Exhale, down. Inhale, up. 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 One more of these. Exhale, down. Inhale, up. Now, if that provoked a lot of sensation, that is okay. That was a nerve glide. All right, so we're going to do the same thing. So get into the same position. All right, let the spine round a little bit. Let the shoulders round. You won't hear me tell you to do that too often with these exercises. All right, take a breath in, turn to the right, and exhale, turn to the left. Try to keep the feet flexed as best you can. Inhale to the right. Again, we're mobilizing that sheath that surrounds the spinal cord. Exhale to the left. Inhale, right. Exhale to the left. We're going to do this 10 times. Inhale to the right. Exhale to the left. Inhale to the right. Exhale to the left. Inhale, right. Exhale, left. Inhale to the right. Exhale to the left. 3 more. Inhale, right. Exhale, left. Inhale to the right. Exhale to the left. 1 more. Inhale, right. Exhale to the left. Okay, so we mobilize that sheath that surrounds the spinal cord and the spinal nerves that go all the way down the leg from like the top down. Now we're going to do from the bottom up. Okay, so we're staying in that same position if you can tolerate it. All right, if you need something underneath your knees, go ahead, you can grab that now. You want to try to keep the feet flexed. All right, if you're having a really hard time, you could put the feet against the wall, use a little prop to help keep the feet flexed. All right, and from here, I'm going to have you go ahead and come into that slouch position, let the head round down. Bring the feet in and then bring the feet out. Try not to just roll the hips. Try to actually move the feet. Bring the feet in and then bring the feet out. Try to keep the toes splayed out. Bring the feet in, bring the feet out, feet in, and then feet out. We're going to be doing a lot with the feet because those spinal nerves run all the way down into the toes. If you have sciatica, you might already know that. Exhale to the outside and breathe in as you bring the feet in and then bring them out. Again, try to move just the foot and the ankle. Try not to just roll the hips and then out. Bring the foot in and then out. Bring it in and out. We'll do one more of these. Bring the foot in and out. Okay, just shake it out a little bit. Okay, so we're going to be moving the feet up and down this time. All right, so round into the lower back, let the head drop down. So we're, again, putting that spinal cord on a stretch. Point the feet down, and then bring the feet up. We'll use some breath with this. Exhale, point. Inhale, pull up. Exhale, point. Inhale, pull up. As you pull up, try to splay out the toes. Exhale, point. Inhale, up. Exhale, point. Inhale, pull 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 up. One more. Exhale, point. Inhale, pull up. Okay, so now we're gonna lay down on the floor and we're gonna be doing some hip stretches. So one of the best things you can do if you're suffering from symptoms of a herniated disc, a bulging disc, or sciatica is significantly increase your flexibility of the hamstrings and the mobility of your hip joints. Why? This is because anytime you go to move, anytime you go to reach forward, bend forward, do anything, the more mobile you are, the less pressure is going to go to that low back area, especially if you're dealing just with a bulge. A bulge can turn into a herniation, so you want to be doing whatever you can prevent getting a herniation. So increasing the mobility of your hips and increasing the flexibility of your hamstring is one of the best things that you can do. And guess what we're going to do right now? Okay, so everybody lay down. Okay, and take your right leg, pull that right hip in towards your chest, and take your left leg, ground it down. Okay, so pulling it in, and we're going to just hold it right here. 1, 2, 3, 4, and 5. Okay, and go ahead and switch. These exercises are excellent to do first thing in the morning to help you get out of bed. So pull the left in, ground down the right. 1, 2, 3, 4, and 5. Okay, great. And go ahead and switch. Pull in the right, ground down the left. 1, 2, 3, 4, and 5. Okay, go ahead and switch. Pull in the left, ground down the right. 1, 2, 3, 4, and 5. Okay, release. Grab the right, pull it in, ground down your left leg. Just breathe here. Breathe in through the nose and out through the nose. 2, 3, 4, and 5. Okay, release. Grab the left, ground down the right, pull it in. 1, 2, 3, 4, and 5. Okay, great. Go ahead and bend both your legs up. Bring your feet together. Drop the legs to the right. Just go to where it feels comfortable. And exhale, go to the left. Inhale to the right. We're going to do this 10 times. Exhale to the left. We're not holding it. We're just rocking, but do it gentle. Be mindful of the spine. Exhale, left. Inhale to the right. Exhale to the left. Inhale, right. Exhale to the left. Inhale, right. Exhale, left. Inhale, right. Exhale to the left. Inhale, right. Exhale to the left. Inhale, right. Exhale to the left. Inhale, right. Exhale, left. And one more. Inhale, right. Exhale to the left. Okay, go ahead and straighten out your left leg. Grab hold of the right. This time we're going to pull the right knee towards the left shoulder and we're going to hold it right there. So we're getting a stretch down this region into the glute and the IT band and the piriformis region. 2, 3, 4, and 5. Okay, great. We're just going to switch sides. Grab your left knee, pull it towards the right shoulder, ground down the right leg. Just hold it here. 1, 2, 3, 4, and 5. Okay, and just release. So grab hold of the right, pull it towards the left. 1, 2, 3, 4, and 5. Okay, release. Grab hold of the left, pull it towards the right. 1, 2, 3, 4, and 5. Okay, grab hold of the right, pull it towards the left shoulder. 1, 2, 3, 4, and 5. Okay, release. Grab hold of the left, pull it towards the right. 1, 2, 3, 4, and 5. Okay, great. So keep your left leg straight. Grab hold of your thigh with both hands. Go ahead and straighten that right leg as best you can. It does not have to go straight. Just go to your tolerance. Flex the foot, splay out your toes, hold it right here. Again, it doesn't have to be straight. Keep grounding down the opposite leg, your left leg, and breathe. Keep the shoulders relaxed, keep your head relaxed. 1, 2, 3, 4, and 5. Let the knee bend. Take the tension off. We're going to do it 2 more times. Okay, gently straighten to your tolerance, flex foot, splay out the toes, breathe here. 1, 2, 3, 4, and 5. Okay, release, take the tension off. And again, flex the foot, splay the toes as you straighten the leg. 1, 2, 3, 4, and 5. Great, and we're going to switch. So ground down your right leg, gently try to straighten the left, flex foot, splay out the toes, hold it there. 1, 2, 3, 4, and 5. Okay, let the knee bend. And let's try again. 1, 2, 3, 4, and 5. Take the tension off. And one more of these. 1, 2, 3, 4, and 5. Okay, so grab hold of your right knee, ground down the left, and pull that right leg towards the outside of the rib cage. Hold it right here. 1, 2, 3, 4, and 5. Okay, release, ground the right, grab the left, pull it towards the outside of the left rib cage. 1, 2, 3, 4, and 5. Okay, release, grab hold of the right, pull it towards the outside of the rib cage as you ground down that left leg. 1, 2, 3, 4, and 5. Okay, release, ground down the right, pull it towards the outside of the rib cage. 1, 2, 3, 4, and 5. Okay, relax. And ground down the left, pull the right towards the outside of the rib cage. 1, 2, 3, 4, and 5. Okay, relax and switch. 1, 2, 3, 4, and 5. Okay, great. Bend both legs up, feet together, drop the legs to the right, just where it feels comfortable. We're gonna hold it here. Spread out the arms and gently turn the opposite way with the head. So turn the head to the left and just breathe. 1, 2, if this hurts, back down. 3, 4, and 5. Good. Let's take it the other way. Drop the legs to the left as you turn the head to the right. Arms spread out. 1, 2, 3, 4, and 5. Okay, great. Let's switch sides. 1, 2, 3, 4, and 5. Okay, go ahead and switch. 1, 2, 3, 4, and 5. Okay, go ahead and switch. 1, 2, 3, 4, and 5. Okay, and go ahead and switch. 1, 2, 3, 4, and 5. Okay, great. So I want everyone to straighten their left leg, grab hold behind the right thigh. You're gonna flex or gently straighten the leg. And I want you to flex the foot, splay out the toes, and then point. So now we're mobilizing that sciatic nerve. We're gonna do 5 pumps. Flex, splay the toes, and then point. Flex, splay, and then point. It's okay if the knee isn't all the way straight. Flex, splay, and then point. Flex, splay, and then point. One more of these. Flex, splay, and point. Okay, take the tension off. All right, and this time go ahead and flex the foot, splay the toes. Now turn the foot in and then turn the foot out. Again, we're mobilizing the sciatic nerve. Turn the foot in and then turn the foot out. Turning in, turning out, turn in, turn out, and one more, turn in and turn out. Okay, let the knee bend. We're just gonna repeat that Just one more time, okay? All right, so gently straighten the leg, flex the foot, splay the toes, and point. Flex, splay, and point. Getting an ankle workout. Flex, splay, and point. Flex, splay, and point. One more, flex, splay, and point, okay? Let the knee bend. Shake the ankle out a little bit. One more on this side, all right? Straighten, flex the foot, splay the toes, turn in, and then turn out. 1, 2, 3, 4, and 5. Okay, great. And now we're gonna just switch and do the other side. So ground on your right leg, support the left, go ahead and straighten to your degree, flex the foot, splay the toes, then point. 1, 2, 3, 4, and 5. Okay, if you're having a lot of symptoms, just go a little lighter, a little gentler. Still do it. Okay, so straighten the leg, flex the foot, splay the toes, and point. 1, 2, 3, 4, and 5. Okay, and now we're going to do the turn in, turn out. Okay, so flex the foot, splay the toes, turn in, and then turn out. Turn in and out. That's 2, 3, 4, and 5. Okay, relax. One more of these. So straighten the leg first, flex the foot, splay the toes, turn in and out. 1, 2, 3, 4, and 5. Okay, great. All right, everyone, we're going to flip over onto our bellies. So I want everyone to prop themselves up onto their forearms. Okay? So I want you to get real active through your legs. All right, so keep in mind when you have a bulging disc, when you have a herniation, the spine loves extension, okay? For those of you that are yogis out there, keep working your back bends. It's one of the best things you can do. All right, so push the feet down into the floor, push your pelvis down, try to lengthen through the spine, and gently pull the chest through. You're gonna feel this in your low back. Try to relax your shoulders, try to relax the back of your neck. Just turn your gaze down so you're not straining the neck, and just hold it here. 1, 2, 3, 4, and 5. Okay, just relax down. Take the pressure off, give your pelvis a little wiggle. Okay, we're gonna do it 2 more times. So prop up onto the elbows, start with the feet, push the tops of the feet down into the floor, push the pelvis down, try to pull the sternum through, try to pull the chest through. Relax the shoulders, relax the head, breathe here. 1, 2, 3, 4, and 5. Okay, come all the way down. Give your pelvis a little love. Let it just sway side to side. Okay, and one more. Push the elbows down, push the feet down, push the pelvis down, pull the chest through. Just relax. 1, 2, 3, 4, and 5. Okay, everyone come all the way down. All right, so now we're gonna switch so our hands are underneath the shoulders. We're gonna do the same exact thing. We're gonna push the feet down, we're gonna push the pelvis through. That's gonna activate our legs. And I want you very gently, just do a little press up, just where it feels okay, and right back down. Not holding it, we're gonna do 10 of these. So as we push up, you wanna organically let yourself go a little bit higher. If it's hurting, just don't force it, okay? So gently push up, keep the legs active, and back down. Inhale, push up. Exhale, go back down. Inhale, push up. Exhale, back down. Inhale, push up. Exhale, back down. Inhale, up. Exhale, down. Inhale, up. Exhale, down. Inhale, up. Exhale, down. Inhale, up. Exhale, down. One more. Inhale, up. Exhale, down. Okay, everyone, we're gonna do one more, and that involves standing up. So just take your time getting up off the floor. All right, we're gonna come to a standing position. Right. So I want everyone to just focus on their feet for the moment. So push the feet down into the floor. So take your big toe, take your little toe, take your heel, equally grounded down, okay? And I want you to stick your bum up by arching your back, all right? So grounding down the feet, lifting the butt up, arching the back here. So we're not in this position, we're arching, all right? And I want you to try to lengthen through the spine. So try lifting up from the top of the chest. Try lifting up from the sternum, all right? And keep all of this as you gently pull the chest through, arching the back, okay? And you get to decide how far you're taking it. Make this feel good, make it feel okay. What I don't want you to do is this. You're dumping into your low back and compressing the spine. That's not gonna help you, okay? So we need to work through the steps, all right? So we're gonna ground down the feet. We're gonna lift the butt by arching the back. We're gonna lift the top of the sternum, and we're gently gonna push the pelvis forward, and we're just gonna breathe here. So keep trying to lengthen through the top of your head. 1, 2, 3, 4, and 5. Okay, relax. Now, if that was hurting, just don't go as deep. Just focus on your length and not how much you're arching back, okay? So ground the feet, arch the back, lift the chest, gently push the pelvis through. Keep lifting up through the chest as you arch back. Just let this feel good. Breathe nice and deep in through the nose and out through the nose. 2, 3, 4, and 5. Okay, good. All right. And one more. Round your feet, arch your back, lift your chest. All right. Gently push the pelvis forward. Keep lengthening through the top of your head, and gently pelvis goes forward as your head moves back, just to your degree, just where it feels okay. 1, 2, keep pushing through the feet, stay strong in the legs. 3, 4, and 5. All right, everyone, thank you so much for joining me. I hope you learned a lot in this class. And for those of you that are suffering from a bulging disc or a herniation, like, my heart goes out for you. I know it's a struggle, but hang in there, it does get better. Okay, everyone.